where patient has worn the device, tried it out at home, a lot of times I want to make sure that the patient has used it for at least 2 weeks. So the rule of thumb is the first week is typically there's some areas of concerns that patients have. They're concerned that they might have jaw pain, muscle soreness. A lot of times that is temporary until they get used to it. It takes about a week for that to happen. That's why I like to do a 1-week telehealth call. So I call patients, ask them how they're doing. Mainly the purpose of this call is to reassure patients, make sure that they feel comfortable continuing to wear the device, making sure that they're aware that whatever discomfort they're experiencing is not permanent. If the discomfort extends, the next visit will be the 1-month follow-up. That's when I go in and I understand that, okay, this is not a temporary thing. There might be some concerns that we need to address, adjustments that we have to make. Sometimes it has to do with their occlusion. Sometimes certain areas is hitting a little too hard. We polish that. Sometimes it has to do with the positioning of the device. So we make all those adjustments. You can get like the acrylic burrs and then go ahead and adjust as need be to the device. Once you make the adjustments, it gets a little rough. You want to make sure you have the polishing stone, polishing disc to clean it up, provide the patients. A lot of times at that stage, what they answer is kind of how you're going to move the appointment. If let's say they have those discomforts, you can go ahead and make those adjustments. If they say it took about a week or two, but then they got used to it, great. The next step is asking their quality of sleep. Do they feel more rested? These are all subjective questions that you are going to collect. You could have them do the Epworth Sleepiness Scale again, as well as the Stop Bang. That way we can have something more objective saying, oh, there has been improvement. If the patient still check off certain things that indicate that sleep could be better and they're not experiencing any jaw discomfort, then you move on to the next step. You protrude it a little bit more. With these devices, they're customized, so that way you go to step by step by step. Kind of like Invisalign clear trays, you go into step by step. Goes half a millimeter to a millimeter, you move it, protrude it, and you go ahead and send it back, 1-month follow-up again. We keep on doing that adjustment until all those check marks are accomplished and they don't show any more indications, or they feel like this is a nice position that they're at and they're happy with it. If you reach a point where now they're experiencing some jaw discomfort that doesn't go away, you know you've reached the threshold for where that's the limit is, you bring them back to the adjustment prior. Once you go there, then you offer them an updated sleep study. Typically that's at the 3 or 6 month stage, so that they have a bit of time to use that device at that level. And that's when, with the updated sleep study, we know objectively, hey, we have treated your disease and you will continue wearing this from here on out. 6 months to a year, just those follow-ups, just to make sure there's no deficiencies in the device. But besides that, treatment is complete and then they're happy.